physically distanced, but back in person. Everyone's doing well, including the state troopers, and just talked to a couple of them that got it initially, and they're all doing great. So everyone's recovered. We also have, during this hour, a couple special guests who will join us remotely up in Muncie and down in Newburgh, Indiana. I'm really looking forward to that. And then Dr. Box will, of course, give her update. And you're going to talk a little bit, you're going to elaborate on contact tracing and the immediate impacts that's the changes, the recent changes that have been underway, and the difference that is and will make as the days and weeks and months ahead unfold. And also I had a bit of good news. We're all in need of some good news during these days. And it's in regards to, and we've talked about this company before during this time, but Indiana Face Mask, based up in Rensselaer, Indiana, in Jasper County, a company that launched back in May, converted some of their lines and got into the mask manufacturing business. It's a part of a company of American Melt blown in filtration, and they stepped up and jumped through all the hoops and applied federally to be licensed to make N95 masks, and out of thousands of submissions, they were one of 5 in the nation that were approved right here back home here in Indiana, up in Rensselaer, and so we're pretty proud of that, and just wanted to say congratulations to the family, to all the employees, to all the teammates, to Fred and Stephanie and Clayton Geyer for their perseverance and for answering the call. They're doing more than face masks. They're doing other PPE products as well, but these N95 masks, and they're going to be able to not just produce millions, which is very comforting in and of itself, but they're also, this is one of those stories where they're going to end up hiring 14 more people to come help. And so that's a win-win-win all the way around. And again, just congratulations to the Geyers and to Indiana Face Mask for stepping up. As I mentioned, you're going to talk about the color-coded map and where we stand, all those indicators. We know that we're all kind of bracing for the next few weeks to unfold, and those lagging indicators that come off of holidays, when people are traveling, when people are getting together with folks that they haven't been around extensively and intimately for a while. And certainly that was the case over the recent holiday, Thanksgiving. We did pull up a couple slides here from the Indiana Department of Transportation, and you can see that over a 10-day period and over Thanksgiving, our traffic was down slightly, about 30% on Thanksgiving Day. And so I did want to take just a moment to say thank you to everyone that said we're going to be safe, not sorry this year, and we're going to spend it with the folks that we're around normally in our very close family. And then when we do that, we're going to take all the precautions necessary, because they're seeing what we're seeing and feeling what we're all feeling, and that is our capacity to care for folks is being strained and stressed, and our healthcare network. And so I just have a lot of thanks myself to pass out to everyone that decided to scale it back or scale it down this Thanksgiving. Hopefully we can do 2 next year. And with that, I will turn it over to you, Dr. Box, if you can get us up to date on where we stand statewide.
Absolutely. And that NIOSH certification
Yep.
that the masks got and the company got, it just means so much to our healthcare providers when they have the confidence to know that those masks are giving them the maximum protection. So congratulations. Thanks, Governor. COVID-19 continues to have a firm grip on our state. Our color-coded map has 16 counties in red this week and 1 in yellow. The rest are all in orange. While the number of red counties is down slightly from the 17 that we saw last week, We've not seen the impact from Thanksgiving gatherings at this point in time. That typically shows up about 10 days to 2 weeks after the event, so we'll be watching our numbers closely over the next week to 10 days. That's incredibly concerning for our hospitals, which remain at capacity in most areas of our state. The number of people hospitalized with COVID or COVID-like symptoms continue to rise, and it's over 3,400 today. That's almost double where we were 1 month ago. Daily hospital admissions also continue to increase at a significant rate. On October 1st, we had 85 people admitted for COVID or COVID-like symptoms. That number was 224 on November 1st, and we've already had 425 admissions reported for November the 27th, and that number could continue to rise as information comes in. This is forcing a number of hospitals to go on diversion, which makes patients travel further to find a hospital with a bed. That impacts not only those patients, but our EMS providers and others who might need their services. We also, unfortunately, are seeing an increasing number of deaths, especially among residents of our long-term care facilities. Yesterday, we reported 142 deaths due to this virus, and another 91 deaths were reported today. In total, 5,688 Hoosiers are confirmed to have died from COVID, and another 285 are considered probable deaths based on their clinical diagnosis. That's almost 6,000 Hoosiers who aren't here this year because of this virus. Each of these individuals has a name, a face, a family who loves them and is grieving. Many of them are Hoosiers over the age of 60. But no age group is immune, which is why we need everyone to help us turn things around by wearing your mask, practicing social distancing, and staying home if you're sick. And, I'm going to add, get the vaccine now when it's available. As the number of cases continue to grow, labs across the country are experiencing significant stress, and the time people are waiting for results has grown. I know this is incredibly frustrating. It's a supply and demand issue that every state is facing. We're working with our local health partners to try to help ease this by encouraging them to use the Bionex Now point-of-care tests for symptomatic individuals. We've distributed almost 270,000 of these cards across the state to local health departments, long-term care facilities, correctional facilities, universities, hospitals, and other locations. We also continue to explore additional labs that may have capacity so that tests can be redirected and we can spread out the workload. We're working to bring another lab on board that can take several thousand tests a day and hope to have them ready within the next couple of weeks. The increase in cases also has placed more pressure on the contact tracing system. We recognize that we needed to make some changes to our contact tracing process because with more cases, interviews were taking much longer and we're seeing more cases lost to follow-up. To help ease this bottleneck, we've shortened our script for interviews of positive cases. Those changes took effect yesterday. The contact tracers will now focus on notifying the case of the positive result, sharing the guidance about what isolation looks like and information on social services if they need them, and concerning medical symptoms or signs to watch for. We will also emphasize the definition of a close contact and provide related quarantine guidance for those close contacts. The contact tracers will strongly encourage the positive individual to notify all of their close contacts. Remember, a close contact is a person who has been within 6 feet of you for 15 minutes or more throughout the course of a day. That includes a person who shares your household or a coworker if you are within that 6-foot space for 15 minutes or more. If you fall within that description, you're a close contact and will need to quarantine, even if you are wearing a mask. These changes will speed up the process and help ensure that people who have been exposed can take immediate steps to prevent further spread of disease. Our contact tracers will continue to gather information the person is willing to share about close contacts, but they won't be asking for a detailed list of symptoms of each individual. In just the first day of these changes, we saw a significant improvement in the number of outbound calls that our contact tracers were able to make. Our outbound calls were up by 64%. The number of people who hung up because they were tired of waiting was cut in half. The time people were on hold dropped. And the number of people who had to leave voicemails fell by more than 70%. We'll be monitoring this closely over the next week to see if these trends continue. We've also advised local health departments that they are experiencing a surge or crisis situations around COVID-19 to follow CDC guidance and prioritize case investigation interviews of people who tested positive for or were diagnosed with COVID-19 within the past 6 days. In an ideal world, we would reach every positive individual and every close contact quickly. But the rise in cases clearly signals that we're not living in ideal times, and we need every Hoosier to help us prevent the spread of COVID. If you're positive, think about who you have been in contact with within 6 feet for 15 minutes or more in a day. Let them know immediately that they may have been exposed and that they need to quarantine. Point them to the many resources on our coronavirus.in.gov website that explain what isolation and quarantine look like and how to do that in your home. Quarantine means staying home, preferably in your own bedroom, using your own bathroom, and avoiding contact with other people. The current guidance calls for people who are close contacts to quarantine for 14 days. However, today, the CDC has issued new guidance regarding the 2-week quarantine period. Under this new guidance, the 14-day quarantine is still available and should be used by people who encounter high-risk individuals, such as someone who works in a cancer unit or is immunosuppressed. But the changes allow 2 options for shorter quarantines. Quarantine can end after day 10 if the person has not had COVID-19 symptoms and they do not have to have a test to do that. Quarantine can end after day 7 if the person tests negative for COVID-19 on days 5, 6, or 7 and no symptoms have developed, but they still cannot get out of quarantine until they've completed day 7. Both alternative options require that the person adhere to strict practices of masking, social distancing, hand washing, and continuing to watch for symptoms through day 14. They also require daily monitoring for symptoms. I want to encourage Hoosiers to follow the 10 days of quarantine unless they have a job that cannot be done from home. Our testing volumes are extremely high, as I noted below, and that is taxing our entire lab system and prolonging turnaround times. We want to ensure that the symptomatic patients who need results quickly can get them and that we aren't creating any additional barriers. Every Hoosier has a stake in preventing the spread of COVID-19, and I'm asking all of you to do your part. We've been very fortunate to have many Hoosiers step up to do just that. Last week, I told you that 4,300 Hoosiers who responded to our Hoosier Healthcare Heroes Call to Action survey, and that nearly 250 college students who had stepped up to serve. Today, those numbers have increased to nearly 4,900 healthcare heroes and more than 1,000 student volunteers. I know our healthcare facilities and schools are incredibly thankful for this extra support, but I also want you to know that we still need more volunteers, more workers, especially in our more rural areas of our state. If you're a healthcare professional, a retiree, or a student with any capacity, please raise your hand. We need you. Finally, I want to provide a quick update on the status of COVID-19 vaccine. Both Pfizer and Moderna have now applied for the emergency use authorization from the FDA. We are preparing to receive limited supplies of vaccine as early as mid-December. This situation is evolving rapidly and information changes daily. But based on what we're hearing now from our federal partners, our hope is that we will have enough vaccine to cover frontline healthcare workers and long-term care residents by the end of December. Just last night, a CDC advisory panel took a vote on who should be first in line to get vaccinated, and I'm glad to report that its recommendation mirrors our vaccination plan. We've sent an initial communication to frontline healthcare workers who are likely to have contact with COVID patients to notify them that they are in the first priority group for receiving the vaccine when it arrives. We will be following up with these individuals when we have more details with specific information on how they can sign up and receive the vaccine. And we're preparing our communications for the next group that will be eligible. The vaccine planning has been in the works for many weeks now, and I want to thank all of our partners who have helped in this process. Things are moving quickly, and that's incredibly exciting. I hope it gives every Hoosier hope that we will get to the other side of this pandemic. Thank you.
Thank you. If we could, just for a second, Dr. Box, when you first shared that new guidance from the CDC, I did what most people who probably just, if they've heard it for the first time now, are doing what I did, and I personalized it to myself, and thought, boy, I wish I would have had that update about a week ago. But better safe than sorry, and I'd rather do more, not less. But, I asked you, and it was pretty instructive, your response. Everything about this is a risk analysis and trying to minimize and mitigate and slow the spread, and our part in that. And I asked you, would you risk it by doing less, even with the comfort of a test and not being symptomatic, et cetera? Would you risk it and scale back? And you said, and if you would elaborate on that just for a second, about it depends on who you are and what you're doing.
Right. I think if your job, allows you to work from home and you can be just as efficient and just as effective there, I would finish out the 14-day quarantine, because that has, we in medicine, we never say 0 and 100%, but it's close to 0% chance that you're going to become infective in that time period and infect someone. But I think that some jobs require that people get back sooner. We already have healthcare workers, because of our staffing shortages, that are working, even though they know that they should be in quarantine because they're wearing PPE. I think if I knew I was going to be around elderly people or people who are immunosuppressed, people who are on renal dialysis, I'd want to be very careful. As long as there were other people there that could staff that, I would probably avoid that. I really think that this is going to help us get more kids back in school sooner. So I'm very, very excited about that. And I think it's going to give a comfort to our healthcare workers who are going back more quickly.
Yeah, going to help. Thank you. I mentioned there at the outset that we had two very special guests joining us today, in addition to the folks who will be standing by. As you all know, we've got about 800 members of the Indiana National Guard who have been deployed since last month, November, all over the state of Indiana, assisting long-term care facilities and our nursing homes. We have Staff Sergeant Myra Beltran, who is joining us from Muncie, Indiana. She's at Morris Woods Health Campus, and she's been working there for several weeks now, and doing things like screening employees and sanitizing the facility and testing employees and residents for COVID-19. And we were just hoping, Sergeant, that you could maybe give us an update on how it's going and what you're all doing there.
Hi, Governor. So what we do here is we help with the temperature check-ins. We do sanitation of like the high contact areas. So that way, if we have residents that happen to leave their rooms for any reason, we're lessening the risk of them, getting sick by contact. We also do, we also help set up and tear down COVID sites. We will help with administrative tasks if they're needed. But it's been a very eye-opening experience here for sure. I know that when you hear about healthcare workers and how tired they are, it's easy to not understand it because you're not in the moment, you're not in the zone, you're not living it. But now that we've been here for a few weeks and you see, how little it feels like we're doing, but how big of an effect it has, it really does put things into perspective. Because even, if you have a guardsman here taking a temperature, it means that there's a technician that can go help take care of residents that are really sick. Or, if you're sanitizing, you're lessening the risk for the residents and the healthcare workers that are already so busy doing 5,000 things at once, so it has been a very, very good experience, especially, when you think of service members, you think of people overseas fighting war zones and things like that. But guardsmen, I think that's what sets us apart, especially the Hoosiers, that hospitality sense that we have. And, we live here, we work here, and we do serve here. So it's been a good experience. It's been a very enlightening experience.
Well, I have a couple questions, and maybe you do as well, Dr. Box, but and you're going to be able to stay with us for the hour. Is that right?
Yes.
Yes, perfect. I know this probably sounds like I'm leading the witness, but and asking you to pat yourself on the back, but which you all are so humble and try to deflect all that positive attention, but how are you being received there on the ground in the facility? I mean, you're lightening the load for a lot of folks, and I hear from folks all over the state about your presence. I was just wondering if you could share what you're hearing just from a personal perspective.
So here, I mean, everyone has been super kind at this facility. I will say I have nothing but good things to say about Morrison Health Campus. Everyone's been so welcoming, and the more they've gotten to know us, I feel like the more that they've opened up. And we have had people tell us like, hey, we really appreciate you guys being here. You know, when we're sanitizing, like I said, or even taking temperatures, that means that someone else can go help take care of a sick resident or someone that's really ill or do something that can help another coworker. So, I mean, it's been, I'm not trying to like toot my own horn, but it has been
You
a
should.
lot of things.
I'm tuning it. Everywhere you guys go, they don't want to let you go. So, I mean,
Absolutely.
we keep hearing this, and it's just such, it's really wind in people's sails. Do you have any questions?
Well,
Yeah.
can you tell a difference in kind of the how the staff is feeling since you've been there? I think just sometimes an infusion of new blood just kind of helps pick everybody up at a time when they really needed it.
So, I mean, I don't know if it's just because everyone is so nice here at this facility, but everyone is always so warm and so welcoming to us. They always ask us if there's anything that we need instead of us. I feel like they're kind of like pampering us instead of us coming in and helping them, because every day it's, hey, do you need something? Did you know that you can have this? And let me show you where this is if you ever need it. Or, so it's been such a warm experience. And I know that it's kind of contradictory to say that because we're here helping fight COVID-19 in any which way that we can. But at the same time, they're like pampering us and just showering us with praises and making us feel welcome. So I hope that we are making them feel as comfortable as they are making us feel.
Awesome.
How long have you been there, Myra?
I have been here, I think about 3 to 4 weeks now.
Yeah. So you were one of the more initial waves of deployment.
Yes, sir.
You couldn't have imagined this deployment I'm imagining. This is not what you thought when you got called up, I'm sure.
Would you raise your right hand?
I had never in my life, when I first enlisted, I never imagined that I would be serving in the middle of a global pandemic. But this is what I signed up for as a guardsman, and I do it with pride. And even if it's just a little part, it's my part, and I'm honored to serve.
It's a big part.
That's a big part. That's awesome.
Thank you for stepping forward and answering the call. We're eternally grateful for your service.
Thank you so much.
Long list of heroes, and
You're
and
right.
our guard, like I said, everywhere they go, they are their sense of duty and then delivering on what they're there for has really made people almost become family, and you could just hear that in Myra's description. We also have, going down south, going from Muncie, Indiana, down to near the Ohio River in Newburgh, Indiana, we have Carly McCormick. And Carly is a registered nurse, director of staff development and infection preventionist at Woodlands Living Center there in Newburgh. And Carly, could you also kind of provide the same perspective or insight about the rush that you've been at this for a while. You've done this before, but this is a whole new world. And can you kind of tell us where we are right now from your perspective?
As far as with the National Guard and with the care of the residents in the facility, we are just trying our best to keep it out of here. I mean, the updates, the newness of everything, the things that you guys tell us on a weekly basis, it's Dr. Box said around here. So it is just making sure that we implement, we monitor, we keep the process going, and none of that is broken throughout the system. And it's you get the good outcomes you are looking for. Sometimes not so much, but it's not for the lack of trying or the lack of having what we need from you all in order to do that.
Has the Guard been, again, I sound like I'm leading the witness, but or I know the answer to this question, but has the Guard been critically important to helping you do your, job under this kind of stress and strain and volume?
Yes, I am so thankful. I'm so thankful that you guys did this. The first day, Althoff and Lane, they reported for duty, and we screened them, we tested them, we made sure that they were fit and ready to go. I gave them a brief orientation related to the regulations, what to do, what not to do, how to do it, and then they took it from there. So they are our main guys that come in and screen our residents, our staff every shift. So day one, I had shown them the process that we had in place currently, but we had a stack of paperwork that needed to be filed and just those tedious tasks that we really needed help with. And they have made it their own. It is really remarkable. They set up their own schedule to make sure that someone is always here day, evening, and night whenever our 80-plus employees come into our building 7 days a week.
That's awesome.
Wilson, the other night, one of our guardsmen, I got a phone call at around 11 Saturday night, and he said, it was actually one of my staff, and she said, the first words out of her mouth were, the Guard told me to. So not only are they making our process easier, but they are making sure that all the steps are completed. So it was an instance that she had a sniffle, and it was new, and I was able to act accordingly and prevent a negative outcome. Yesterday, we got a new guard, Irk. He reported for duty. I made sure he was fit. He came in because our guard Lane welcomed his beautiful, healthy baby boy, Maddox David Lane. And I briefed him. I did the education he needed, but Althoff took over from there. He knew exactly what he needed to do. He told them where he needed to be, what he needed to do, how the process worked. Made sure he had my number in order to be able to contact me whenever he needs. The handrails in a nursing facility, people don't think that much about that, but they are a form of transportation for some residents. That is how they get from point A to point B, and they make rounds 3 times a day, even more than that, to wipe down our common areas and our handrails. They make sure our PPE is stocked on all of our units, gloves, gowns, masks, what do you need? And then at the end of each day, they always report to me, making sure that I don't need anything else. And it is.
I hope General Lyles is watching this. He's going to be so proud of him.
Yeah. Carly, you're just proving that we're in this together and we're going to get through this together. No matter how long it takes, we're going to get through it together. And I salute you, and I suspect that you've had some of these individuals that you listed by their last names. It sounds like you've already become part of the military as well, but that they're saluting you as well. Thank you and you're going to be able to stay with us during the Q&A portion as well, because some folks may have some more detailed questions for what's a day like where you are. So with that, Rachel, we'll go right to the Q&A. Thank you, Carly, very much.
Okay. We will begin with Kathy of the Ferdinand News.
And by the way, Kathy, good afternoon. I think I misspoke. If you're about to hammer me on the number of guards, men and women, I said 800. It's more like 1,800. So I
wasn't going to hammer you on that, but I do appreciate that we have one of the finest guards in the whole United States.
Yep.